The General Administrator of the Old Jeshwang Community Health Center has spoken to Star TV about some of their interventions aimed at enhancing the health and well-being of the community. The Old Jeshwang Health Center offers a variety of essential services which are crucial in ensuring that residents have access to comprehensive health care. However, the health center is still grappling with several challenges. More in this report by Awasani.
The Old Jeshwang Health Center was established in 2000 after the community members recognized the need for a local healthcare facility. Sohna Amijob and the area's councillors, NAM, National Assembly member, Alcalos, and other high-profile individuals from Jeshwang have all contributed to its advancement. Chernoyade, General Administrator of the Health Center, says the facilities doesn't have a 24-hour service when their tenure began in 2021, adding that they've updated everything, including the pharmacy, the lab, nurses, and doctors. He recalled that there were no doctors at the outset, but that during their tenure, they were able to facilitate 6 professional doctors for the health center to advance the activities of the hospital.
We are not having doctors also who stay. All of our client base we are seen by nurses. The nurses are doing a very important job. I'm not trying to say that they are not important in the system, but actually you need that kind of professional level in medical field. Everybody has your own cadre, what you can do. So it is important for the health center to have that type of personnel, the doctors. So we embark on trying to get doctors for the facility, and we have 5 doctors now. To be more precise, 6, but they are on they come on shift basis. So these are some of the developments we've made, and we also make that we employ. Like I said, we have an electronic record system. These are one of the innovations that we have done, and it has geared towards allowing us to be able to invest in modern technology in the laboratory to make sure that we do proper diagnosis for patients that are coming here.
Yade explained that the health center has grown from a small facility to a larger one, attracting patients from nearby areas like Farafene, Brikama, and Biam due to the quality of services offered. He also mentioned some challenges they face, including issues with staff social security loans, the need for more ambulances, and ensuring that the health center meets standard regulations.
During this period, the facility was not having a structure. Like, it was not working as an institution. So you had only an administrator. But we know that if you want to grow, we need to institutionalize the facility, meaning we needed to have a section. So that's where we employed coming together and get a HR department. Very good question you asked, because this Mr. Ahmed Keta over there is our HR manager, and he's the one responsible for the welfare of the staff and the nurses, the doctors that are coming here. And this was not here then, and their contracts were regularized, and all of the benefits that they're supposed to get were regularized. And then we did this in 2021 when we started, because it was necessary because of a lot of things that were not according to the law of the labels and all those things. So
he emphasized that the health center is not a private entity.
Because the highest cost of medication is a problem, because actually a community facility cannot charge private fees. So, but we do also buy from where the private is buying, because actually the government, health is very expensive, and the government cannot do it alone. Even though they are our partners, they are helping us and they are supporting us every day, and we normally go to their stores, and there are certain kind of items that they give to the facility. And this is very important that the government and the regional health directorate give a lot of support. We must mention that they give a lot of support to Old Jeshwang Health Center. But I just want to say also this thing, that we are not a private entity, and they should not view us as a private entity. And we have a plan. We have a drug and lab revolving fund that allow us to pay our staff, because the government, none of the staff we have here is paid by the government. except for the public health officers who are directly by.
Other things that clients are benefiting from the health center include access to easy medication and community cover for residents in the community who cannot afford the medical expenses. Fatoumata Sise, the matron of the health center, highlighted the various services available.
We conduct all services here. We have antenatal services, outpatient services, family planning services. It's a maternal and child health hospital anyway. So we have an outpatient ward where we do our observations, and we have the antenatal services wherein we're using the T-care system. The T-care system is a system wherein when you come into the facility, what we do is you're directed to the receptionist, wherein we register you and send you to any of the consultation rooms. It depends on the service you're here for. We have the antenatal clinic. We have 3 outpatient clinics, wherein we have 6 medical doctors on ground and 1 gynec doctor. So it's a clinic, a facility wherein any service you require, you can have it here.
Going forward, there are plans to transform the health center into a full hospital in the coming years, further improving healthcare accesses for everyone in the area. For Star TV News, this is Awasane.